listening to 40 Weeks, a production of the Pregnancy Podcast with Vanessa Merton. Visit pregnancypodcast.com/week for all of the 40 Weeks resources and sign up with your due date to get each episode delivered to your inbox when you start a new week of your pregnancy. Thank you for tuning in to the 40 Weeks podcast. Welcome to week 31, only 9 weeks to go. You can see a picture of what your baby looks like this week, read the transcript, and access the additional resources for week 31 at pregnancypodcast.com/week 31. Your broccoli-sized baby is growing this week and is about the size of a bunch of asparagus. Your baby measures 16.5 inches or 41.8 centimeters and weighs 3.9 pounds or 1.8 kilograms. Your baby continues to shed lanugo and add fat to help keep them warm. They still have a lot of weight to put on, and they're going to gain at least another 3 to 5 pounds before birth. Your baby is putting in longer stretches of sleep, and you can probably notice more defined patterns of their wakefulness when they're moving and their rest when they are staying pretty still. It may seem like they're on the opposite schedule from you. That's because all of the moving you do during the day rocks your baby to sleep, which means they may be more active at night. In one study, half of participants played Twinkle Twinkle Little Star 5 times a week in the last trimester. At birth and 4 months of age, the same melody was played back, but with a few notes changed. The babies in the group who had heard the song in the womb had a stronger response to the unchanged notes than those who were not exposed to it. Not only does your baby hear the music you play, but they can also remember it later. As your baby grows and your uterus expands, it's putting additional pressure on your lungs and your other organs, and it can push up on your diaphragm, which is the muscle below your lungs. You may find yourself short of breath and getting winded easily. Sitting or standing with good posture can give your lungs more room to expand. And if you're getting out of breath on walks or while exercising, slow down and take it easy. As you get closer to your due date, your nipples could leak colostrum. This is a yellowish fluid that nourishes your baby in the first few days until your milk comes in. Colostrum is like a superfood for your baby, so it's a good thing that your body produces it. If you do have some leaking, it shouldn't be enough to soak through a bra and a shirt. If you'd like to, you can use disposable or reusable breast pads. Those will also come in handy in the first few weeks of breastfeeding when leaking is most common. Many pregnancy symptoms can negatively impact your sleep. About 24% of expecting mothers have restless leg syndrome. This is a neurological disorder that presents as bothersome sensations in your legs that are relieved when you move them. Also, the prevalence of snoring is much higher in pregnancy. Loud snoring in the 3rd trimester affects 14 to 45% of expecting moms. Snoring may be more bothersome for your partner than for you, but there is some research that links snoring to adverse pregnancy outcomes. And these are just a couple of many issues that can impact your sleep. For more in-depth information on troubleshooting sleep issues, visit pregnancypodcast.com/sleep issues. A couple things to think about this week as you are getting closer to your due date. One is that many practices have multiple doctors or midwives, and the practitioner who will attend your birth will be the person who's on call when you go into labor. Right now is a great time to verify who could attend your birth. If it could be somebody that you have not met yet, you may consider asking for a prenatal appointment with them in the coming weeks. And if you're seeing an individual doctor or a midwife who has a private practice, ask who their backup is in the event they cannot attend your birth. The other thing is, even if you're planning a vaginal birth, you should be knowledgeable about a cesarean section. The low-risk cesarean rate is 25.9% in the United States. Low-risk mothers are at least 37 weeks, they're first-time moms, and they have a baby in the head-down position. Of the 1 in 4 low-risk women having birth via cesarean, many of them did not plan to meet their baby that way. Rather than be completely caught off guard if you're planning a vaginal birth and your care provider recommends a cesarean, you can be prepared for that. There are podcast episodes on cesarean birth, gentle cesarean and vaginal seeding, and when a C-section is absolutely necessary. And links to all of these episodes are included at pregnancypodcast.com/week31. A tip for dads and partners: there's a lot of things that are geared towards moms, but they're fantastic for dads or partners too. Baby wearing is one of these things. Carriers are an excellent way to spend time with your baby, to be hands-free, to go for a walk, or just give mom a break. When you're shopping for a carrier, make sure that it's comfortable for you and that it's in a color or style that you're happy to wear. Thank you for tuning in to the 40 Weeks podcast. You can see the full transcript and all of the resources for this episode at pregnancypodcast.com/week31. Next week, your baby's digestive tract will be almost fully developed. Until then, I wish you the very best in your pregnancy journey.